Today, I am unveiling a national strategy on COVID-19 and executive actions to beat this pandemic. This plan reflects the ideas I set forward during the campaign and further refined over the past 3 months. It consists of my transitions teams, the task force, Tony Fauci and the team here today and other experts put this plan together. Our national strategy is comprehensive. It's based on science, not politics. It's based on truth, not denial, and it's detailed. You can review this entire plan by going to whitehouse.gov. It is so detailed, it is over 198 pages in complete detail what we're going to do. Our plan starts with mounting an aggressive, safe, and effective vaccination campaign to meet our goal of administering 100 million shots in our first 100 days in office. We're on day 1. This will be one of the greatest operational challenges our nation has ever undertaken. And I'm committed to getting it done. We're committed to getting it done. And as I explained last week, we'll move heaven and earth to get more people vaccinated for free and create more places for them to get vaccinated, to mobilize more medical teams to get shots in people's arms, and to increase vaccine supply and get it out the door as fast as possible. Yesterday, we got started. We directed the Federal Emergency Management Agency, FEMA, to start standing up the first federally supported community vaccination centers with the goal of standing up 100 centers within the next month. The Centers for Disease Control and Prevention will launch the federal pharmacy program to make vaccines available to communities in their local pharmacies, beginning early within I think it's by the 7th or 8th of February, but in very early February. We'll also task the Department of Health and Human Services to prepare and expand the pool of medical professionals who can administer the vaccine, and to ensure we have enough vaccinators, the people doing the vaccines, to meet the nation's needs, and quickly. In addition to this effort, our administration will be asking Congress to fund for the funds to grow the public health workforce. We also are going to take immediate steps to partner with governors, mayors, and other local officials who we've been talking to all along, who are on the front lines of this fight. We directed FEMA to establish a COVID response liaison for each state, which means every state will have a point person at the federal level to maximize cooperation between the federal government and the states, and where it falls short, to be made known about it, may be made known immediately. This is a model we used to respond to Hurricane Sandy, which I was deeply involved with. And in just a few moments, I'm going to sign a declaration to immediately begin reimbursing states 100% for the use of their National Guards to help COVID relief efforts, something Democrats and Republican governors alike have called for. But the brutal truth is, it's going to take months before we can get the majority of Americans vaccinated. So, while we increase vaccinations, we're going to take steps necessary now to slow the spread of the disease as well. One of our 100-day challenges is asking the American people to mask up for the first 100 days, the next 99 days. The masks have become a partisan issue, unfortunately, but it's a patriotic act. But for a few months to wear a mask, no vaccines, the fact is that they're the single best thing we can do. They're even more important than the vaccines because they take time to work. And if we do this as Americans, the experts say by wearing a mask from now until April, we'd save more than 50,000 lives going forward, 50,000 lives. So I'm asking every American to mask up for the next 100 days. Yesterday, I signed an executive action that requires masks and social distancing on federal property. Today, we'll be signing additional executive action to extend masking requirements on interstate travel, like on trains, planes, and buses. And in light of the new COVID variants that you're learning about, we are instituting now a new measure for individuals flying into the United States from other countries. In addition to wearing masks, everyone flying to the United States from another country will need to test before they get on that plane, before they depart, and quarantine when they arrive in America. Our national plan launches a full-scale wartime effort to address the supply shortages by ramping up production and protective equipment, syringes, needles, you name it. And when I say wartime, people kind of look at me like wartime. Well, as I said last night, 400,000 Americans have died. That's more than have died in all of World War II. 400,000. This is a wartime undertaking. Today, I'm signing an executive action to use the Defense Production Act and all other available authorities to direct all federal agencies and private industry to accelerate the making of everything that's needed to protect, test, vaccinate, and take care of our people. Well, we've already identified suppliers, and we're working with them to move the plan forward. Now, look, our strategy includes a plan to safely reopen schools and businesses while protecting our workers. Today, we're directing the Department of Education and the Department of Health and Human Services to immediately provide schools and communities with clear guidance and resources to safely reopen the schools and child care centers.